I'm Dr. Lawrence Phillips, Associate Professor of Medicine at NYU Langone Health and immediate past president of the New York City chapter of the American Heart Association. A cardiac arrest occurs when the heart is not able to supply blood to the rest of the body. It's usually electrical in nature, and because the heart is not able to beat, the rest of the body is starved of oxygen from blood, causing a sudden collapse and essentially death. When a cardiac arrest occurs, it's extremely important that it be immediately recognized and CPR started as quickly as possible. In CPR, you're allowing externally circulation of blood by pressing repeatedly on the middle of the chest. Since in many situations, a cardiac arrest is caused by an electrical abnormality, an AED or defibrillator allows a jolt of electricity to reset the heart, bringing it back to normal heart rhythm. By using that in combination with CPR, you maximize the likelihood that the person having the cardiac arrest can survive. So a cardiac arrest is different than a heart attack. In a heart attack, the blood flow to the heart muscle is being restricted, usually by a blockage of an artery. And this is classically viewed as pain in the middle of the chest, and a patient will be brought to the catheterization lab and hopefully have their artery opened with a stent. In a cardiac arrest, what's happening is a sudden change in the heart's ability to pump blood, usually electrical in nature, and it results in a sudden collapse or loss of consciousness, and that arrhythmia, by not allowing blood to go to the rest of the body, causes death. The best way to treat an out-of-hospital cardiac arrest is to rapidly start CPR. First, you need to recognize that a cardiac arrest has occurred. Someone has suddenly collapsed or lost consciousness. Second, you need to get 911 activated so that rapid response can get advanced care for the person. And third, you want to immediately start hands-only CPR with rapid compressions in the chest to allow blood flow to continue supplying oxygen to the rest of the body. When an AED is available, you want to rapidly take it out, connect it to the patient, so if an arrhythmia is the cause, they can be shocked safely to bring them back to a normal electrical rhythm. A cardiac arrest can be for many different reasons, including a heart attack and decreased blood flow to the heart muscle, an electrical abnormality, either something genetic or related to prior damage of the heart, or other reasons that impact the body's ability to circulate blood. It's extremely important that everybody learn bystander CPR. We know that almost 80% of cardiac arrests occur in the home, and that many others occur in the workplace or non-public places. And because of that, when somebody collapses, you might be the only person there to help. We also know that less than 50% of people with cardiac arrest have CPR attempted on them. And when CPR is done and done correctly, you can actually increase the likelihood of survival by 2 or 3 times. So it's extremely important that people take the opportunity in a non-emergency setting to learn how to perform bystander CPR. So if that event actually occurs, they'll be comfortable stepping in to save a life. Many cardiac arrests are caused by an electrical heart rhythm. And with hands-only CPR, you're able to increase survival. But the other way to revert to a normal heart rhythm is to use a defibrillator. So it's important that we increase awareness and availability of AEDs so that in the setting of a cardiac arrest, it can rapidly be found and used and restore normal heart rhythm, resulting in a saved life. So as much as talking about learning hands-only CPR is straightforward, actually seeing how it's done makes all the difference. Take the next less than minute to watch this video where you can see how easy it is to save a life.